Greetings and welcome to week 8 of ME 180. This week we're going to talk about infection control. Because the medical assistant, or for that matter any other healthcare provider, has interaction with patients who have infectious diseases, uh, they need to understand the basics of infection control so they can excuse me, so the spread of disease can be prevented and not passed on to other patients and staff. Now, knowledge about microorganisms and how infections spread from one person to another is necessary before the medical assistant performs any tasks in the medical office. We know that the body has many natural defenses to prevent microbes from entering the body, such as skin, tears, stomach acid, cough reflexes, things like that. Stopping the transmission of infectious diseases within the office itself can be accomplished by following some simple guidelines. In addition to regulations and guidelines, there's that are in place to help the healthcare professionals prevent the transmission of the infectious agents, or microbes as we call them, and to initially break or eventually break the chain of the disease transmission. And we know the CDC and OSHA work to stop the spread of disease by establishing and enforcing these guidelines and regulations. We know that microorganisms are found in the air we breathe, on our skin, on everything we touch, even in our food. Microorganisms are small, so small that they can only be seen by a microscope. Medical assistants need to understand how to protect themselves and how to prevent the spread of microorganisms. How do we accomplish this? Well, there's some standard precautions for infection control. These are for medical assistants. The standard precautions for infection control for medical assistants in a hospital or healthcare center are, and that includes the doctor's office, wash your hands using plain soap. Wash after touching blood or body fluids, secretions, excretions, uh, any contaminated item. Wash immediately after your gloves are removed between patient contact. You need to avoid the transfer of the microorganisms to other patients or environments. And a lot of times we don't think, or people don't think. They think that if they're gloved, and let's say you're cleaning a room, that glove has the cleaning solution on it, so therefore you're not going to spread anything. Not true. Secondly, you need to wear gloves, oddly enough. Uh, Gloves, especially, like, let's take for instance the dental office, didn't come around until the 80s. They were using their hands. Uh, Wear gloves when you're touching blood, body fluid, secretion, excretions, contaminated items. Excuse me, as I said, with washing your hands. Put on clean gloves just before touching mucous membranes and non-intact skin. Change your gloves between the tasks and procedures on the same patient after contact with material that may contain uh, high concentrations of microorganisms. Remove the gloves promptly after you're finished doing what you're doing, before touching non-contaminated items and environmental surfaces, and before going to another patient. And wash your hands immediately to avoid transfer of the microorganisms to other patients or environments. Make sure you wear a mask and eye protection or a face shield. Uh, Protect your mucous membranes of the eyes, nose, and mouth during procedures and patient care activities that are likely to generate splashes, sprays of blood, or body fluids, excretions, or uh, secretions. And you know from watching medical shows on TV that sometimes, uh, even though the doctors are masked, if their eyes aren't covered, they can get blood in their eyes from squirting blood. When needed, wear a gown to protect the skin and prevent soiling of your clothing during the procedures that are likely to generate splashes, sprays of blood, and get body fluids and stuff on you. And then remove that gown promptly when you're finished, as promptly as possible, and wash your hands to avoid transfer. Um, Make sure that patient care equipment that is soiled with blood, body fluids, and all that. That you clean them. Clothing is put in its special bag to be cleaned by the laundry. Uh, your sharps and everything is put away the way it should be into the sharps container. And ensure that reusable equipment is not used for the care of another patient until it's been appropriately cleaned and processed. And single-use items, again, are disposed of. Make sure that you follow the hospital procedures or office procedures for routine care, cleaning, and disinfection of the environmental surfaces uh, or any other frequently touched surface. Um, any type of cloth that is used, linen or what have you, that is used, and I know most doctors' offices have gone to the paper covers, but we still have cloth gowns for patients to put on. So uh, make sure that the handle and transport and process used for this type of soiled linen with any excretions, blood, or anything like that on it uh, is handled in the manner that is required to avoid transfer to other patients and environments of any type of microorganism. Uh, Occupational health and bloodborne pathogens. Prevent injuries when using needles, scalpels, and other sharp instruments or devices, and when handling sharp instruments after procedures, when cleaning used instruments, and when you're disposing of needles. Never, and I do mean never, and you will always see this happening, but it is the most dangerous thing. Never recap used needles using both hands or any other technique that involves directly the point of the needle toward any part of the body. Rather use what we call the one scoop or one-handed scoop technique or a mechanical device designed for holding the needle sheath. Uh, do not remove used needles from disposed syringes by your hand. Do not bend, break, or otherwise manipulate used needles by hand. Place used disposed syringes and needles, scalpel blades, and other sharp items in puncture resistant sharps containers. These are the red containers, located as usually as close as uh, practical needed. My tongue's getting tied today. They're usually within the area you're working or close to it. Uh, so place those in there when they're used, and place reusable syringes and needles in puncture resistant containers for transport to a reprocessing area, in other words, where they're clean. Use resuscitation devices as an alternative to mouth to mouth. Uh, we learned that in or we're given when we're doing CPR, taking CPR in class, you notice they give us those little reusable uh, mouth-to-mouth things to lay over the mouth. Uh, my mind escapes me today, or my memory escapes me today, what it's called, but you can buy those and carry with you your personal ones that can be re-cleaned and reused. But the idea is to not put your mouth on their mouth, because a lot of times you never know. And what do we get? Uh, Saliva coming out of the mouth. They could throw up. Blood could gush out of the mouth. Who knows what could happen? So you have to be really, really careful. Okay, that's it for this week. Um, I look forward to your posts this week and your conversation between each other, because just because you post doesn't mean you're finished with discussion. Discussion means that you also have to post to two other people, whether it be myself, because I will go through and I post to everybody's uh, postings. I reply to everybody's postings, I should say. Uh, so you can reply to me and one other, or you can reply to two of your fellow students. I prefer you do the fellow students because I want interaction between all of you, so that it gives you a better understanding of what you are talking about. It gives them a better understanding. And a lot of times I may say something and you may not get it, whereas another person says the same thing but in a slightly different way, and you understand it just like that. So get your postings and all your work in on time. I have placed a announcement that I want you to read, and it's not directed at anyone. It's just, I just needed to say this to you, so and to every class. It's not just this class; it's every class. So, and make sure that you understand what it's talking about, and don't say, "Well, I don't do this," because it's not directed at you. But if you're a person that does procrastinate, take it to heart and understand it. Um, and I will be talking to you during the week. So have a great day. Thank you.